So welcome back, everyone. I'm Jeff Feynman here with Dr. Christina Shambro, who's kind of here, but not quite here by video, and Gail Pope. They're at the Great Haven Shelter in California, and we're here to talk about holistic management of vomiting cat, kitties with GI problems, and what you can expect and what is the normal for cats and dogs, and should cats be vomiting hairballs? Or I remember one of my teachers. Oh, and sorry, I'm sorry, I'm not good at typing and talking at the same time. Remember Richard Pitcairn saying that cats seem to have a hobby of vomiting. They enjoy it so much they've made a hobby out of it. So I guess you've had probably the most cats out of anyone here. You've shared your home with what? A couple hundred cats over the years?
Oh, over the years, probably 600 or 700 at least.
Oh, wow.
That's some very cats throwing up.
Yeah, I bet. So tell me, bring me back to the days before you adopt the holistic and homeopathic lifestyle and point of view. What was going on with the hairball or with vomiting in your 90 kitties that you had on premises at one point?
You know, that's a really interesting question. And as I think back, because I wasn't at all educated in any kind of holistic understanding, to me, cats threw up. It's just what they did. And furballs were a very normal thing. We paid attention to grooming more when we saw cats throwing up furballs. I was lucky to never actually experience a cat getting blocked with a furball, although at the vet hospital where I worked, we did see that from time to time. But I really just had the understanding that it was probably diet related, and that, you know, maybe they'd overeaten, undereaten, or they needed a drug. And of course, because I could take them to work and have them checked out very often, you know, we did take the drug course before we really thought of anything else. And it was only some long time later that my thought pattern, my learning, my understanding of what happens went through a really radical change. And these days, we do see furballs very, very occasionally, very rarely. I have one lovely cat, Chelsea. Hello, Christina.
Made it, finally.
And Chelsea throws up a furball once in a while. She's a long-haired black cat. She has some kind of minor skin, but actually she's an amazing girl because she's come through a long, long journey with homeopathic. Oh, look at this. The health and longevity. Yes, my animals are right there. I should be wearing that, Christina.
You should be. We need to send one to you.
I think so. And, you know, Chelsea's had quite a long journey through multiple health issues, and she's now nearly 20. She's a long-haired black cat, and from time to time she will deliver a nice furball. When she does, the first thing I look at is her diet, then making sure that she's groomed properly, and then probably in the same day I call her homeopath, and we start looking at her picture to see if anything might have changed for her constitutionally that might affect what's going on. And, you know, for her, it's a fine balance. The only symptoms she has are skin issues from time to time, which cause her to overgroom, and that brings up the furballs. However, they're very, very rare now. They were a lot more. And so gradually we're at a better balance for her. And so when I see furballs, I don't ever think of it as a natural thing. But I do that, you know, I follow that procedure. We make sure that they're not tearing out chunks of fur. I'm also very aware that cats do groom, they do swallow fur, and if their digestive process is working properly, then that fur will go through automatically and naturally and never be a problem. If I pick up a stool, which I have to admit I do from time to time, and I need to examine it for my vet, and I'll break it in half, or I'll have a good look at it, and invariably you will find fur in it, which tells me that things are working properly. So when they actually can't digest that fur, you know something's wrong. So we adjust EFA content to the diet, something like that. And then, as I said, we go straight to our homeopath and see what needs to be done. So that's kind of it from me. I think this is a great subject, and it's one that I think the listeners should be really, really attending to. So over to you two experts.
Well, you kind of you stole my thunder and gave away the punchline about why cats are getting fur balls in the first place. That's great. Why don't we first start though by defining what a hairball is? Let's say my cat eats a big meal and he vomits a minute later or regurgitates, and we should also talk about what vomiting is and what regurgitation is. Vomits up or regurgitates the food, and there's some hair in it. Is that a hairball?
It's not a hairball, but it fits with what Gail just said, which is if they're healthy, you might not even see hair in regular vomiting or regurgitation, because unless they had just licked prior to eating and then had a little bit of hair still in their stomach, but it should have been out of the stomach by then. So while it's not a, quote, fur ball, which is just vomiting fur and liquid, it definitely is still, as Gail said, an indication of early warning. It's time to look to see, why is this going on?
Great. So yeah, that's where I usually start. Is I'd say about 2/3 of people say that that I've talked to that there's a hairball problem. And what they mean is vomiting with hair problem because the hair is still present, as you said, in the stomach when it shouldn't be, or as again you said, they just groomed and they have those fabulous little barbs on their tongue, which are designed to help get out the hair. And they haven't had a chance to pass to either digest that or pass it down further into their intestinal tract. So,
but the most important thing is, again, ditto everything Gail said. And the most important thing is for people to not accept that cats just throw up hairballs and need to be on a supplement like hairball medicine from the vet, because vets think it's normal, or from the store, or a holistic one like Butamix, or there are plenty of holistic hairball medicines out there, but that's not the thing to be using. The way to approach it is to look at the overall health.
Wow, I haven't heard Butamix in many years. Is that still around?
I don't know. It was maybe 3 years ago.
Wow, yeah. I think hairball remedies, which are usually just petroleum-based or oil-based, are covering up the underlying problem, which is, what we're here to talk about is the hairball vomiting, and vomiting in general is one of the early warning signs that something's not right internally and what you need to be doing. But I think the best approach is that you journal and write down either in your calendar or in Christina's journal or another journal as far as when they're vomiting, what's it associated with, was it observed. You really can't tell that your cat's vomiting unless you actually saw it. And the reason being is that it could be, instead of the process of vomit, it could be actually the process of regurgitation. And that's also very important to distinguish one from the other. Whereas regurgitation is a passive process. They just kind of open their mouth and liquid pours out. or what we like to call sometimes for some of my guys, extra burps. It's like they're burping, but the big thing comes out, or there's an active, they're retching and vomiting. But if you just find it on the floor, there could be either one. And even if it's undigested food right after they eat, it could be either vomit or regurgitation. But hairball is going to be usually a tube. It's often by people who don't have a lot of experience with kitties. It's often confused with a stool because it has often has that cylindrical shape of the intestines, but it's just hair that's usually all tangled up into a tube and a little bit of liquid and or maybe a little digested food around it. But I usually see it with just liquid. So there's a couple of strategies to deal with that. Number one is what Christina just said, which is, to increase lubrication in the diet, to go ahead and use Buddha mix or one of the. Oh, okay.
Never mind. I was pointing to Gail, saying it was Gail that said she adds essential fatty acids to the diet, but you were talking about the Buddha mix. So sorry.
No, I was just reading.
You were addressing the other way.
So that's a very effective way to cover up the underlying process. So we're used to, number one, looking at the whole picture. Is it a vomit? Is it a regurg? How frequent? How severe? Is it affecting the cat's life? And then number two, if you're so inclined, you can do some diagnostics. If it's an older animal, it's probably not a bad idea to at least get some baseline, blood work and or x-ray, and definitely a vet exam just to get up there and feel the belly and make sure, there's no, as Gail alluded to earlier, no hairball obstructions. Just feels like a foreign body sitting there in the GI tract. But, from what I've seen, those kitties tend to get pretty sick, and if they're obstructed, and frequently even go off their food altogether. Gail, Christina, what do you find with those hairball emergencies that may require surgery, that often require?
35 years, never ran into one.
No, I've never, other than at work where I saw a cat come out, 2 or 3 come in and they were obstructed. But other than that, I haven't ever had one at home. Touch wood.
I think it's pretty rare.
Yeah, I think, but yeah, it's funny because in conventional practice, I see a couple a year. And I don't think since doing homeopathy and holistic care, I've seen a single one either, like you, Christina. Of course, I don't have you've got at least 15 years experience on me.
That's true.
Yep. So we can cover up the problem by diet, number one. I mean, a lot of these kitties are on a dry food diet. And the very first thing you want to do is increase the moisture in their diet. And ideally, that would be with a raw, fresh food diet. But even if you switch from a dry food to a canned food. So that's very funny, Christina.
What? Which?
I'm Jennifer's veterinarian.
Oh.
I thought you knew that.
I thought you were, but how do you have a cat that's not been eating for a few months and losing weight?
I don't think it's hers.
Right, that's what I think. That was why I'm saying needs a different vet.
Yeah.
The vet thinks she may have ingested unknown poison and has hyperthyroid. So whatever vet that's going to needs a different vet.
Remember
that even though Jeff isn't taking on new clients, there are plenty of phone call homeopaths that are available There really are. There are.
and there are plenty of other ways to get a a different or broader point of view, and they start with just really if the vet doesn't have an open mind, if your vet, and this is part of building a vet care team, if your vet is not willing to embrace the fact that maybe the food is not correct, maybe there's something else in the lifestyle that's not correct, maybe there are other options, then I would agree that you probably do need to either find another vet or just say thank you for your ideas. Now we're going to move forward, because I know in my phone consultancy practice, frequently we'll work with local vets that they do the exams, they do the diagnostics, but they don't actually treat the problem. We'll go ahead and talk about the treatment of the underlying issues later on. So what should be the next step, Christina? We have a kitty that's vomiting. Maybe it's vomiting every day, maybe a couple times a week. Why don't we first say what is normal? What is an acceptable amount of vomiting? 0?
Maybe 1 hairball twice a year.
Yep.
Now, here's the thing. Again, this is what's really true. Is what's normal depends. So if you have a cat who is vomiting more than once a year, or not, or not at all, then you have to look at each vomiting episode. So if it's a cat that goes outdoors and it was hunting, then it might throw up some of what it ate. It's not normal to throw that up. Or maybe it got into something in the house. Maybe it did get into a poison. So if you can see any reason for one vomiting issue, but they're fine otherwise, then you sort of put it in the journal and move on. But a healthy cat really should not vomit at all.
And what do you see there in California, Cal? What's the situation with your kitties that you've got right now? They're all older. They're all on a fresh food diet. Where most
And
she said when they vomit, that means they're sick.
In all honesty, I can't remember the last time that I actually cleared up cat vomit. I really, other than Chelsea with a fur ball maybe once in a couple of months, that's kind of it. I mean, we're very lucky, our animals, all that. And it was interesting, as you were talking, it was kind of filtering through my mind that an animal doesn't have, I mean, what is good health? How do we know when we've achieved a perfect balance? We don't see symptoms. However, sometimes we don't see symptoms, but there is still a chronic situation. In renal failure, when it's very well balanced, you don't necessarily see any symptoms, but you know the out of balance state is still there. And that's probably where most of my animals are. If you look at the diagnostics of their blood panels, you'll see all sorts of various things that tell you that something's, getting towards the end of life. Doesn't necessarily mean we're seeing symptoms, and we certainly don't see our animals vomiting. Now, having said that, at the moment, I don't have anybody who has been dealing with IBD or one of, a really difficult cancer of that area where vomiting would be a classic symptom. None of my animals are in that situation. So it's a sweeping statement to say I don't see vomiting because they're all dealing with other issues. And I feel really privileged and lucky at the moment. I don't see vomiting or diarrhea. My house is very happy.
And you bring up a real, very important point that I think, Jennifer, relates back directly to your friend's kitty or relative's kitty. It will be very important to see what the examination and diagnostic testing shows. You said that the local vet thinks that it's hyperthyroid or poisoning, but is that based on phone call? Was that based on test how old is the kitty. Is this a younger cat where it's certainly possible that it's based on, so the kitty's about 12. And
so it's a 12-year-old cat, and it was based on tests.
So if they did a free T4 as well as the regular T4, then I think that hyper overactive thyroid vomiting is very, very unlikely. But if they ran a full screen, they probably already ruled out kidney problems and other problems, which often leaves us with the gastric motility issue, which means that the stomach, which has their pacemakers in the stomach and intestine, they contract and push the food towards the intestines. If they're not working, if there's what's called a motility problem, then that could certainly mimic the same signs of vomiting, not eating, hyperthyroidism, etc., etc. So as I mentioned in the chat, I think that a lot depends on what the kitty's guardians, how they're oriented. If they want to pursue further diagnostics, then certainly an endoscopy, where they actually go down there and look into the stomach intestine and grab any biopsies, because your other big rule out is, as Gail implied with one of her kitties, IBD, or inflammatory bowel disease, because that can manifest in vomiting and pancreatitis and other diagnostic labels that may or may not have really direct bearing to us as homeopaths. One of the beauties of consulting, as Christina recommended before, consulting a homeopath, first off, is they'll be able to start treatment without all the diagnostic testing. But frequently, guardians, in my experience, they want an answer. They want to be sure that nothing else is going on. I don't know. Christina, how many people do you work with? Because you talk with people on the phone via consulting frequently. How many of them would be okay if they were doing homeopathy, not making progress, doing homeopathy, not making progress, go to the local vet, do diagnostics, and find a problem there, and they would be okay with going back to homeopathy?
Actually, I have a beautiful example of that. This was early in my practice, so this was in the maybe mid-90s. Very holistic family. They slept in a family bed, had 3 children, organic, maybe vegetarian, I don't remember. And I don't remember if they were feeding a good canned quality or were feeding fresh food exclusively. And one of their cats started vomiting. And not feeling that good, but basically it had just started. I think maybe vomited for 2 days. So we took the case, prescribed a remedy. Cat stopped vomiting, was eating, had a stool, seemed to be back to normal for 3 days. Then it started to vomit and not eat again. But some things had changed in the personality or heat seeking or something. So I prescribed a second remedy. And again, the cat was fine for 2 or 3 days, and then it started vomiting again, and it was passing stool. And so I said, why don't you go to your local vet? It's up to you, but I think it's time now to go to the local vet, get a palpation, maybe an x-ray. And they did. And the veterinarian said, the x-ray looks normal, but we really need to do a barium swallow. And they said, nah, let's not do a barium swallow. Let's just keep going. So I treated the cat for another week or 2, and the same thing kept happening. Remedy, better, worse. Remedy, better, worse. And I said, I think you need to go do the barium swallow. I think there, something might be going on. Well, yep, it was. It was a piece of corn cob stuck in the intestines. So so they did surgery and removed the piece of corn cob and resected the gut. Now, what the remedies were doing was getting the vital force of the cat, the vitality of the cat, so healthy that corn cob probably went back into the stomach. And then the cat would pass stool, would eat, would do fine. And then as the corn cobs tried to get through the intestines, it would get stuck again. We'd do a remedy. It would move back into the stomach, but it wasn't getting digested, which is what happens with these corn cobs. What the surgeon said, a really nice local vet who's open to all of this, what the surgeon said was she had never seen such a clean abdomen with a foreign body obstruction. She said right where the corn cob was, the gut was dead. But on each side of it, it was perfectly fine and there was no peritonitis. So this was just an obstacle to cure. It just couldn't quite pass that piece of corn cob. Now, had the cat been healthier, it should have been able to. Had I maybe found a better remedy, maybe that would have gotten it to pass. But so that's a perfect example of, the stepwise, how you can go stepwise. Now if this cat had started vomiting, not eating, and hadn't responded to a remedy, I would have sent them sooner for the barium swallow. But I think that's a good example. But most of my clients, just because I've been doing it for so long, I tended in my practice to have more people who were already pretty committed to the holistic homeopathic approach rather than newbies who were coming in wanting tests, or maybe I just spent so much time talking to them that they didn't need tests that often. And certainly some did. And some of the ones where I was failing in my treatment would go in and do tests and then maybe go the conventional route because I wasn't getting anywhere due to my lack of skill. So we have a vomiting cat with IBS or lymphoma. So Gail has treated a number of cats with IBS or lymphoma. I've certainly treated a number. Jeff has treated a number. And you absolutely can cure those with homeopathy, or at least what I found is with older cats, I often could only move them towards a cure. And what that meant is I would have to continue prescribing for the cat. They'd need to stay on a low potency remedy, or we'd go a few months without a remedy, and then we'd have to go back on the remedy again. Or symptoms would change a bit and we'd need a new remedy. But throughout that time, the cat would feel much better and do much better, which means a cure, moving towards a cure. But some of these older cats, I just wasn't able to get them completely cured. Gail, what's been your experience with your IBD cases?
Yeah, exactly that. Peaks and valleys. I must say over the year, and some are formally diagnosed and some are symptomatic and we don't do any formal diagnoses with, but I think there's kind of a mix of those who have come in with the symptoms. We're always very respectful of changing diet when there is that kind of a problem going on because of the vomiting, because of the diarrhea. We don't want to exacerbate it. So we go very, very slowly with the diet change. We find out what they like to eat, or if we can, what their normal diet is, and then we start introducing raw, really small amount at a time, and gradually see how that affects their system. We also work with supplements like, the clay products to help if the diarrhea is really bad, and I have seen that work very well. Obviously, the very first thing we're doing is starting to work homeopathically, and sometimes it's astonishing how fast the symptoms start to ease and actually end up going away. And we've got a cat who's eating fresh food, who's just doing really well. And, they stay with their same veterinarian all the way through, and they just need a little tweak here and again, and maybe not again. Some do really well. Those who, obviously over time, we've had some who have been real challenges. They've had little bits, and I think this is where you were talking, Christina. We've had some that have had huge peaks and then huge valleys, and then just when we think we're going to lose them, they suddenly have a bright spot and they do much better again. And I think it is mainly those are the very elderly animals who are very close to the end of their life anyway, and there isn't time. I think, you talk about homeopathy as peeling back the layers of the onion and gradually working towards health. It takes years to become unhealthy, and it takes a long time to become healthy again. And I think sometimes animals just simply don't have time. Christina's, I'm sure, going to say, if we had time, we can cure. That's what homeopathy does. But
well, yeah, it's not just. See, the thing is, it's not just time, and this is why I hold the place of sometimes you need other modalities. In order to find the correct homeopathic remedy, the animal's vital force has to be strong enough to give us clear-cut enough symptoms, or to respond to the remedies we give with symptoms that allow us to choose a better remedy. So part of that has to do with our ability as a prescriber, and part of it has to do with the vital forces ability. Part of it has to do with the owner's patience of being willing to hang in there and deal with the symptoms with soothing things. So again, haha, it depends. So I wouldn't necessarily say we could cure. I mean, theoretically, we can cure everything, but we really can't always.
no.
And I think your corn cob story is a great example of, where homeopathy can cure, but there are other ways to address the problem, just like when you discuss other modalities. Your corn cob story reminded me of a great story from the homeopathic literature of a fantastic prescriber, a fantastic human homeopath, curing most of his patients, but he had one patient with this pain in his rectum. It just was really, really, really annoying and bad. Couldn't even sit down. And as was happening with your kitty, the prescriber would prescribe a remedy. The patient would get better, but the pain would come right back. Prescribes, it just kept going on, and he would go from one homeopath to another one.
Yeah.
Finally went to a conventional doc who took a look and pulled out the splinter that was in his rectum, and he was cured. You have to really be cognizant of obstacles to what the body is able to cure, because the body, there are a lot of physical things like that which really, the body, you may see, the body expelling a splinter, expelling a foreign body, but again, you need to take it all in context and look at the whole picture. Well, as with Vegan Travel's older kitty, if the kitty is dramatically losing weight and won't eat, diet change to a fresh food diet is not going to be, an approach that really works for her or him. That would be a great candidate for homeopathy. Those kitties, and of course finding finding other foods, perhaps AD or other even canned foods that have higher calories in them to help the weight gain, because weight loss in and of itself, once cats get below that 4-pound level, when the 12-pound cat drops below 4 pounds, we get worried about their survival, about their long-term survival. But anyway, back to hairballs. So we talked about hairball remedies and palliating that way. We talked a bit about diet and not feeding dry food like we do every week. As far as trying to, in this case, it's very important. Vomiting and constipation are two areas where the diet change can help right away. The other big one that I always try to stress is brushing. Frequent brushing, or take a washcloth and just wipe them down, get off that excess hair every day. That's going to help a lot of kitties, especially if you don't already brush them or pet them every day. Comments?
Well, we've really been focusing on cats, but although dogs don't vomit hairballs, dogs vomit also. And so this, all the things that we've been saying about cats applies to dogs as well. That if you're tolerating an occasional vomiting or an occasional diarrhea, don't. You need, it's time at that point, you know, one of the things we see, and it's not so much for those of you who are on live today, because we know who you are, but it's for those of you who are listening to this on the replay, and we may not know who you are. So what we often find is that when an animal is very ill, they seek out holistic care, and the animals are cured of that illness, whatever it was, whether it was skin or diarrhea or vomiting or even something more serious like diabetes or Cushing. And then because they're so healthy, they forget about us holistic vets, and they start going to their local conventional vet because that's who they hear about at the dog park. That's what they see on TV. And so the next time their dog has diarrhea, they go to the conventional vet and they get treated conventionally until all of a sudden 6 months have gone by and the problem is still there. And then they call me and go, help. And I go, I'm just wondering why you didn't call sooner. And the answer is always, I don't know. I just didn't think about it. So it's very important for everybody to set up support systems so that each of you with animals in your lives have other people, friends, through the internet or local, who are using holistic approaches. And anytime your animals get sick, you call each other first. And then if your animal isn't the sick one, you'll probably think about, oh, well, you should try holistic. The one who's sick is more in this emergency state of anxiety that goes rushing to the conventional. So I really encourage these partnerships and working together. So, I mean, we have the Facebook group that Jeff started that people will post that there's an issue and several people will come in and answer. So that's very important.
And that, you know, that is exactly one of the benefits of online holistic support. You know, that whether it's Facebook, with the Vet Homeopathy Course Facebook group, there's my Facebook page, there's Christina's Facebook page, there's the Holistic Care for Animals, which is the AVH Facebook page. There's a lot of support out there on Facebook alone. Certainly, there's also support, you know, via email, via our weekly blabs, via talking to other people. Part of the reason we're starting to do every couple of weeks, you know, live and webinar, just Q&As is just for that exact reason, to provide the support, answer the questions, to, you know, help you make better medical and holistic medical decisions. Actually, this is the URL I'm posting now. If you want to get the, be one of the first ones to get the feeding course, the general holistic overview course that we're doing, as well as, you know, find out about the other support options. Yep, that'd be great. And are you able to get on your Facebook page, you know, on a fairly frequent basis, Christina?
Yeah. Oh, yeah. Anytime anybody does a message, I get an email.
Oh, really?
So,
great.
Yeah, and so I go there. I may miss a day, but at least every other day.
Great, excellent. So yeah, I did a recent search on the Meetup app. There are holistic dog and cat meetups all around the country. You know, and I think that's great. Yeah, I think it's just a great thing. You know, my dream is for us to find the time to train a bunch of people, give them all a stack of cards to hand out when they go to the dog park, or hand out to their neighbors or anyone that asks, that will refer them for holistic options where they can learn about raw feeding, where they can learn about this, and that there are other ways out there to approach the vomiting cat and all kitties in general. And yes, Vegan Travel, I urge you to please get into contact with Christina as soon as you're able. It sounds like your kitty really needs the help.
So the other thing is that if you go to local holistic health food stores for pets, many of them have listings. So there's a really cool store in the DC area called the Big Bad Wolf of local veterinary care. And some of it's holistic and some of it isn't. I haven't talked to them about it to see if the conventional ones that are on there are good ones into holistic or not. I don't think they are, and so I wanted to talk to them about that. But that's another place to go is go to your local holistic pet store if you have one. They're in amazing places, little tiny towns in Pennsylvania. Yep. Not just in.
I know we did a full day homeopathy seminar at Ben's Daughters. I'll give Tina a little shout out here in Great Barrington, Massachusetts. Ben's Daughters. And I believe that all they sell there are raw and fresh foods, and do referrals to holistically oriented vets. And I do want to stress that any vet, even if they only practice with drugs and surgery and what we would call conventional methods, they can still be holistically oriented. Mm-hmm. If you go to a vet or you go to a doctor and they only have tunnel vision to look at the one thing, oh yeah, show me the growth, yep, that's got to come off, then yeah, that's not looking at the whole big picture. But a lot of veterinarians now, a lot of doctors now are going to ask about lifestyle, ask about the diet, exposures, and that's more of a broader view of health, a broader holistic outlook. And that's what I think we're all striving for everyone to do, because that's just good medicine, right? And isn't that just what every doc and every vet should be doing, is looking at the whole picture. So other hairball strategies. The first step is to define the problem. How often and what are they vomiting? The next would be to write it down, report it, observe, or record it in Christina's journal, which, by the way, will also help you see the other common but abnormal symptoms that may be there at the same time. And then report it. Report your observations, report your findings. Oh, in the past couple of weeks, he's had 16 vomits. I mean, the journaling is, I just cannot overstress the importance of doing that. Report what you found, ideally to a holistically oriented, either a homeopath or just open-minded conventional vet, and go from there. And if, like with Vegan Travel's kitty, or with Jennifer's friend's kitty, they're left with, well, we don't really know, but we can try this and try that, then you want to try and start thinking outside the box. And Vegan Travel, I just had this thought for something you may want to try to help stimulate your kitty's appetite, which is really, really, really easy to get into a cat. Just a drop or two a day. And that product by RX Vitamins, RX Hemp, I've seen it work wonders in a lot of situations where the cats, where the guardians are not willing to pursue other therapeutic modalities like homeopathy. So I know Gail's had a bunch of hemp experience, but I don't think you've used RX hemp, or have you used that? You have, good.
What I did with RX, I started off with Canna Companion, and we still use that in different strengths, regular and the extra strength. And they're a wonderful company because they really care about their clients, and they will consult for free with anybody who has questions about whether it's the right thing for their animal. Really, really nice company. What I did find, though, is that towards the end of life, or when you're dealing in a health situation where your animal's not eating properly, you can't put that powder in their food. Well, we don't do it in food anyway, but when they're used to maybe taking a mix and taking it via a syringe and doing so happily, that can change. And getting something like hemp into them in a powder form is really difficult. So we actually have both products now, and we use the RX product where we just want to use a few drops morning and evening and do it that way. So yeah, it's a great product.
And I just looked, and it's available at Amazon.
Yes.
I thought the RX was just with vets, but it's actually on Amazon.
Yeah, we've actually had this with RX. I asked them recently about this. The RX doesn't know where they're getting it from. They don't know. Be careful about the source of your supplements. When Amazon buys directly from, say, Now Foods, like they do, and they provide the supplements there, that's great. That usually is handled very well. But these gray market things like RX Vitamins products, which are not supposed to be sold to Amazon, which Amazon isn't buying directly. Yep, exactly what Amy said there. It's a gray market. That those Amazon RX products are all of questionable origin. So some of them may be great, depends on who's selling it, who's storing it, how fresh is the product. And that really goes for any supplement in general. I always look when I order on Amazon, is shipping from, are they actually the ones that are fulfilling the order? Or is it just somebody who bought it from their neighbor and they're selling it via Amazon or eBay? And I guess that's why we started back in the 90s, basically making most of the supplements that I use in practice available on the web. And there's my shameless plug. That's actually a direct link to the Home Vet Store web store, where you can get
excellent.
RX, yeah. But yeah, it is available for sure in a bunch of places. And if you don't want to buy it online, your vet might even be able to order it, because many of the veterinary distributors, main distributors, are now even carrying RX vitamins. In fact, we recently stopped after many years of ordering direct from RX vitamins because it's fresher and newer for us to get it directly from a veterinary distributor. So who knows? But yeah, Vegan Travel, you can order it certainly online, but you can also ask your vet if maybe they would get you a bottle. And yes, you're right. If your vet prescribes it, the insurance will cover it. At least that's the case for Embrace and Pet Plan. Actually, you know what? Embrace covers supplements even if a vet doesn't prescribe it. Pet Plan doesn't. No, Pet Plan will cover anything pretty much that a vet prescribes. Embrace, they give you an allotment of a couple $100 up to, I think, $650 a year back. If you have a wellness policy with them, any supplement you buy, they'll pay for. And again, another shameless plug for Embrace Insurance. That, to me, is a no-brainer. If you have pet insurance policy, go with Embrace, get their wellness policy. You're going to always get back more than the cost of your policy every year. Cover all your supplements, cover many trainings, other holistic interventions, cover certainly homeopathic consultations. It's great. But so is Pet Plan, and a few other insurance. Do you guys use any insurance over there, Gail, or did you ever use insurance?
I did years and years and years ago, but in fact, I was just actually turning it over in my mind where you were talking. I don't think there are many insurance companies out there that would actually insure an animal sanctuary. It's an interesting question because I was just sitting there thinking, oh my God, one of our biggest expenses annually are the supplements. They're all the holistic supplements that we use. To have those covered by insurance, wow, that would be an interesting exercise.
Yeah, but I think in that situation, since you have to already have a policy with them to get a wellness policy,
Yeah.
I think it can end up being cost effective. And actually, the rescue in Florida asked about the exact same thing for employees as well as their dogs. And that's why I asked that question directly to Embrace. They can't do that by state law, by state insurance laws. They can only do one individual at a time.
Yeah.
So that's great. Yeah. So Susan's pup that wasn't walking, wasn't jumping, she said he's doing well. So
wonderful.
That's great. So, and Jennifer asked earlier about kitties that vomit because they're in heat. And I personally have a cat that wasn't spayed. And every time she comes in the heat, she either goes off her food or vomits or both. In fact, last week, well, I shouldn't share this out personally since it gets TMI. But the cat vomited on Amy in bed. So like 3 in the morning, 3 in the morning, and she said, "Oh, yes, all right." But she's only about this big, so she's like 5-6 pounds. So sometimes her vomits are bigger than she is.
But now, Jeff, would you say that a cat vomiting when they're in heat is because they need their constitutional remedy, that they're not completely healthy?
Absolutely. Yep. And there's no question that this rescue kitty, because Tiggy came to us as a rescue and was not healthy to begin with. And she had an upper respiratory and probably still has her herpes upper respiratory. And because she's like, the cobbler's children that don't have shoes, she's not getting properly treated by me. I give her a remedy every once in a while when it gets really bad.
Right. So, Amy, I suggest you choose a new homeopathic vet.
Yeah.
Not me, someone else.
No. I thought you were volunteering.
No, I'm not real good at tracking down remedies anymore. No, the waterproof sheets is just temporary palliation. That's
because eventually the acrid vomit's gonna go right through there. Yeah.
Oh, really? Through the waterproof sheets?
If it's acrid and it burns or beats it, yeah.
Ah, interesting.
So I guess acrid is Amy's middle name. That's what she's saying. Or vomit, I wasn't sure about that. But anything else, diet, brushing, lubricants, we didn't talk, and we should talk a bit about enzymes. Homeopathy is going to treat the underlying problem, but I'd say a good percentage of people that think they'd like to do homeopathy are doing holistic medicine with supplements and diet change. And again, we maybe next time we'll talk further about the distinction. But those people, do you guys have any favorite enzymes that can help digest? the hair internally?
Well, we use what I think is a really good product. I've used it for years and years and years by Animal Essentials, and it's enzymes and probiotics mixed. And we put it in the food all the time. The other product that I love, I use a company called Delimmune for their immune support. They have a stronger probiotic called Delpro. And whenever I really feel the need of something separate from what everybody's just getting in their food, then I turn to Delpro.
Okay, great. So enzymes are going to palliate, brushing is going to palliate, diet may palliate, or actually may raise the level of health high enough that the body is able to cure. And actually it can palliate, but it can also cure with diet. Actually, I think it was Hippocrates, the first doctor ever, who said, let diet be your medicine. And I think that, you know, food really can be a medicine. It can be medicinal. But I also think that all of us would agree here today, before we go, that the vomiting kitties, whether it's from hairballs, triaditis, pancreatitis, any other diagnostic label, all of them could benefit from homeopathic prescribing.
Absolutely.
Yeah.
Well, I think we're done for the day.
So I guess we're done for the day. I just want to announce or pre-announce that we are planning to have a both live and webinar session here in Weston on September 10th, so the weekend after Labor Day, hopefully after things calm down a bit, to try and address more questions, because last weekend, you know, we went way over and it was all pretty much just content and basic stuff, and I really, really would like to, you know, get that dialogue going, that holistic support going that we're doing here today, and which we really hope that you all will avail yourselves of. So, and yeah, and you're going to be in Maine doing that in a month, right?
September 24th and 25th in Maine, 2-day introduction to homeopathy. And I put all that at the beginning of the chat, so you can scroll up to the beginning. And then in Maryland, Southern Maryland, on Friday night, and then October 1st and 2nd. And then I'll be in Columbus earlier in the month for the AHVMA conference.
Right. So here is the Holistic Options School, and I will see you all next week.
Sounds great. Bye, everybody. Bye, Gail.
Everyone. All right. Bye-bye.